artificial intelligence in the medical records. Okay, so let me first of all introduce Udayraj Patare. I'm working as an founder of this one of the firm called Udayam AI Labs, where mostly I'm working with the large language models by the different companies like OpenAI, then the Meta, then Llamas, these type of the models that we are currently handling. In my firm, we are trying to develop some models which are related to the either medical field or in the agricultural sector, in the education sector as well. And right now, this is my first time to jump into the healthcare industry, healthcare, so that one can develop the generative AI models where the patient will take the help from that models and one can get benefits from that models. Such a models we are trying to develop nowadays. And that's why for that purpose there is expertise required from your side as well in order to develop the model. And in order to develop the model, there is two kind of expertise required. Number one is domain expertise, that you are having that and I'm not having that. Second thing, it requires the technical concepts clarity that I'm having and I'm not sure about you, but you can have that. Right? So in how we are going to use the artificial intelligence in medical record, in that perspective I'm going to talk with you. Lots of experiences, lots of expertise I'm having that I'm going to share with you here, so that at the end of this session you will be definitely gets benefited from this session. Okay? Here is a topic called how I am going to transform this healthcare with the help of artificial intelligence for the improved patient care and the efficiency. Just a moment. Next slide. Yes. Okay. So please note that this session, let us try to keep it as interactive as possible. It means I'm not the speaker over here. You have to talk, you have to interact with me as possible. Here is the first question, and this is general discussion is going on, that how often do you feel burdened by the medical documentation? Many of the times it happens that doctor most of the times works with the patient, but some of the times it needs to work with the documentation as well in order to get the best result for the doctors and for the patients as well. So here is an open-ended question to all of you. Can I have any quick answer for this particular question? So I already told you that please try to keep this session as interactive as much possible. So here is my question: how often do you feel burdened by the medical documentation? Lots of burden, right? So I'm here to help you out here. How I can integrate AI in order to get rid of this problem, that to get rid from this burden. How AI models are going to help? I'm going to showcase that things to all of you. Okay. So here is the next slide, which is first of all, I think sir and already all of you are saying that it is a daily struggle, right? So can I assume that the answer is daily struggle? Yes, there are some options, daily struggle, sometimes, rarely and never. But I can assume that for some time that yes, it is a daily struggle to in case of the medical documentation. Okay. So here I am going to speak about that topic, how we can get rid of that medical documentation by using some various models which are already available in the computer industry. Why artificial intelligence in healthcare? Because there is a rising patient data volume, right? You already know that, rising patient data volume. Then there is a documentation time is really taking the time away from the patient care. That is the thing we have already noted. And here AI can help with the speed as well as the accuracy and safety as well. So that here artificial intelligence is going to save the doctor's time, so that the doctor can spend more time on the patient, right? Then the recovery of the patient as well as, recovery of the patient will be very speedy once the doctor is upgraded in AI. Right now you are having knowledge related to the only your field, like the medical field, but if you upgrade with the AI, if you upgrade with the concepts of the AI, then for sure you will definitely spend a lot of time with the patients, and the percentage of improving the patient health will be definitely high. Here is research says that doctor spends up to the 35% of their time on the documentation. This is the research says. Please note that at the end of this session there will be a small quiz, and here in that quiz there will be some small questions can be asked. So please have attention on each and every word that I am going to speak from here. So doctors most of the time spends 35% of their time on the documentation, and this is because of the increase in data, increase in volume of the data, right? You might be aware about that how much data is rapidly increasing. You might be aware about that there is a small unit, smallest unit of measurement of the data, that is, I think it is a bit, right? Have you heard about this bits, bytes, that things, right? So bits, bytes, these are the smallest unit of measuring the data. After that there is a data in the byte. After the byte there will be data in kilobyte. After KB there is a data in megabyte. After the megabyte the data is in gigabyte. After the gigabyte the data is in terabyte. What next? What next after the terabyte? Zettabyte. After zettabyte there is a petabyte. After the petabyte there is a yottabyte. After the yottabyte there is a brontobyte. There are lots of units are coming, and right now US and UK currently handling such a type of the medical data. Right? So this is, if you compare this brontobyte or this geobyte unit with respect to the byte, it is around 10 raised to 30 bytes. And 10 raised to 30 is very small number, isn't it? Yes or no? It is not a small number, it is a very big number, and in order to tackle with this data, there is expertise required from both of the sides, technical perspective as well as from the medical science field perspective as well. So if we integrate that both things together, then there will be definitely something good is coming in the upcoming years. So here, next let us discuss about the next slide. Here is one picture that I am going to show you, stress doctor and relaxed doctor. Right, the stress doctor is the one who is not using AI in his practice, and the another doctor which is using a lots of AI related thing in his practice, and he is a relaxed doctor. And we want you to be relaxed so that you will pay more attention on the patients, right? And AI can help reclaim that time so you can focus on what you do best, treating the patients, and yes, AI can help that reclaiming that time so you can focus on what you do best, in that is in terms of treating the patients. And here let us see how artificial intelligence, but first of all how artificial intelligence is going to help you, but before that how exactly AI is going to help you. How exactly AI is going to help you, but what is AI? If you see that artificial intelligence, machine learning, deep learning and natural language processing, these are very fancy words from the AI field. So artificial intelligence, you can consider, you can assume that AI means the computers that are learning from the data. So if you have the data, large amount of the data, computers are going to learn from that data. Your task is that to need to provide that data to the computer, to the machine, to the robot, so that it can learn from that past data and predict something. So that is AI. What is ML? ML is a machine learning that learns the pattern, right? Most of the times you have seen the pattern, that this is the pattern for the diabetic patient, this is the pattern for the some other disease patient, right? So there are some patterns are always happening, and there is a need to study that pattern. And how we can study that pattern? With the help of the machine learning approach, we can study that pattern, but for that we need to understand the machine learning, not in depth, but at least quick overview you should have. You should have a quick idea of that topic, then one can integrate ML related things in your practice. Here is a NLP. How many of you heard about NLP? NLP means, anyone? It is not related to the neural. It is, yes, it is a natural language processing. Natural language processing. On top of that concept only, the entire generative model is building upon. Which generative models? Generative models like ChatGPT. Have you heard about ChatGPT? Yes. So ChatGPT is built upon only the single concept called the NLP, natural language processing, and that NLP basically reads and understands the medical notes, whatever the notes, whatever the history of the patients that you are having. That NLP concept, with the help of some model, with the help of some algorithms from the computer science, they are learning from that past data, and then that will try to predict. So these are the three very fancy words from this IT sector, and now it is required and it is expected from you that to integrate both of these things together in order to get the much better results. So here I am just trying to explain you artificial intelligence, that computers that learns from the data. So in medical practice, in medical science, you can think of AI as the big umbrella. Most of the times it happens that there is a lots of confusion in AI, then ML, then deep learning, then natural language processing. There is most of the times confusion happens. So in order to that, I am just trying to remove your confusion from that perspective. In medical field, you can think of AI as the big umbrella, and inside that big umbrella, there are the two new fields are always there, and that is machine learning and deep learning, right? So if you have a little bit knowledge about the mathematics, that is a subset. Subset is the word that we have already discussed in 9th and 10th standard, right? So here machine learning is a subset of the AI, deep learning, natural language processing, these are the subset of AI. So you can consider one big balloon, that big balloon is of AI, and inside that big balloon there is one another big balloon. Inside that balloon, that is the balloon of ML, machine learning, and inside that machine learning balloon there is one another balloon called the natural language processing or deep learning. So this is how the things are correlated with each other. And here, what is machine learning? Machine learning, so here is one example as per the medical science perspective. AI is an AI system, can process all of a patient's data. That can be the lab test, it can be imaging, it can be vitals and history, and then it can suggest the possible diagnosis or the red flags. The computer is going to do that. But for that, it should have a clear data, and we can collect the data from some standard website. Can someone tell me that from where we can collect some standardized data which is a clean one? Anyone?
So
Any possible case?
we have to feed that, no? Suppose standardized, suppose there are we have got
Standardized data we have going on.
From that we have to feed that.
We have to feed that data.
So if you have to compare something in the test, I have to feed that, and then they will show that.
Yes, first of all, we have to feed that data to the model, but before feeding that data to the model, from where to get that data?
Standard
From standard protocols.
Standard protocols.
Yes, standard protocols. Like, so what are that standard protocols that I want to know from you? From where we can collect the data? Yes, from this medical college also we can collect the data. From some standard institutes we can collect the data, and then we can give that data to the models. There are some official website from where we can collect the data of this medical related data, that is data.gov. You can write this this particular website. Data.gov is one of the place from where you can collect the most accurate data from that thing. Kaggle is one of the Kaggle. Kaggle is one of the website from where you can also collect the data. GitHub is also one of the platform from where you can collect the data. These are the three names. Please try to remember. What are that? GitHub, Kaggle, and data.gov. From that you can collect that data. Because why we require the data? Because we have to feed that data to the models. For that we need a clean data, right? So how to decide that data is a clean? That is your expertise. Also, there are some machine learning techniques are also available to clean that data. Okay. Then here is a machine learning. You can consider it is like a doctor which is learning from thousands of past cases. Machine learning is what? You can consider machine learning as a doctor who is trying to learn from the past cases, right? That is machine learning. So I have tried to write these things in such a way that, because you are from the medical science perspective, in order to that I have written that all of that concepts here in your language. You can consider NLP as another branch of AI, and it is focusing on the language. Okay, what language you are writing and how computer is able to understand your language and try to generate the new original responses with respect to your questions. So you can consider one example, doctor notes, discharge summaries, right? Or even spoken consultation. NLP can help with you that. NLP can read, NLP can transcribe and summarize them into a structured medical records. Okay? What can be the types of medical records? These are the types. I hope that these are the types of the medical records that you might have heard about, right? That is electronic health record, EHR data. Imaging and lab results, this is also medical records data. Prescriptions and discharge summaries. Is it right? Discharge summaries, then wearable device data. Can someone give me one quick example of wearable device data?
Cochlear plans.
Yes, sorry.
Cochlear
Airplanes. Is there any other possible answer?
For
Smartwatches is one of the best example, right? From where we can have the data, wearable device data we can have, and through that data we can study, we can take the actionable insights from that data, right? So here, AI in imaging, AI in, just a moment so that you can see here. Okay, AI in imaging, chest X-ray example. Here AI can analyze chest X-ray, highlight abnormal regions and provide a probability score for conditions like pneumonia, and not only recognition or not only it provides the probability, it also provide you, it will also assist you that how we can diagnose that particular patient by providing some standardized prescription. But please note that here AI is coming in your field, it does not mean that AI is replacing you, not replacement, but it is assistance for you. Okay? Then next slide, where AI fits. Yes,
what
please.
is the accuracy for the same data?
Yes, yes.
Because there are many differential diagnoses which are just minutely different from one disease to the other.
Correct.
So what is the accuracy of
Suppose
this
if
data?
somebody has fed in that there's cavitation for 100 patients.
Yeah.
Right.
And suppose he's showing something else.
That is the problem.
See, that is a very nice question. I can hear from both of you. See, AI is a probability, and I hope you understand the word probability. Probability is always between 0 to 1. We cannot 100% trust on that models. That is the first possible answer from my side. We should not 100% trust on the model. That is the part actually come in AI ethics, AI possible consideration in the AI ethics as well. But you should not trust, but it can definitely assist you, or it can help to give you the best possible response for the particular
So
patient.
you can suppose there is a you told about the summary and the discharge. You can't. There are many people, many doctors who are not filling properly. So I am taking data from one.
Right.
They are not filling properly.
Correct.
Right. So once if you have fed that some substantial, the patient is having lymphadenopathy, he is having fever, he doesn't have fever. So what is the thing? It will perpetuate the bias.
Correct. It can raise the bias, but see, most of the times doctor handwriting is you know that very well how the doctor handwriting is. But some of the models like the Med Gamma, how many of you have heard about Med Gamma? Med Gamma is one of the model that requires the data coming from the doctor's prescriptions. It reads the data and it is try to relate that particular handwriting with the previous or original data that the model is already fed on, and then it is trying to generate 70 or 80% accuracy it is trying to give at this moment. Suppose you are writing some spelling like paracetamol, but I don't know this is a paracetamol, I don't know. But model is trying to predict that it is somewhat kind of paracetamol. It is not 100% correct, but it is around 70 to 80% it is correct. And yes, the models are evolving nowadays. Models are trying to learning from the nowadays very heavily, so that in future also it can happen that the accuracy may get increased around 90%.
That means there is a threat that we are going to lose the jobs.
No, I already told you that doctors are not replaceable, but AI going to help you. Doctors are not replaceable. Your expert is always required. Okay, so here is a AI in predictive analytics for disease prevention, for preventing the disease, for identifying the risk factors, predicting the disease outbreaks, and providing the prevention strategies. At the time of COVID-19, there is one mathematical model has been published at that time, and I have one research paper on the same topic, COVID-19. There is one algorithm, that algorithm trying to learn, and it is trying to predict that in the next month or in the next week, that how many patients can be COVID positive, right? So that model, that are the mathematical model, and that such a type of the models are, these models are built upon that AI related things as well as some algorithms, and then it is trying to predict that what can be the patients, is it reduced, will it be reduced or will it not going to reduce, accordingly what can actionable insights one can take from that things that can be done with the help of the AI. AI applications in drug discovery, time being I am not going to take this topic, but yes, AI in robotic industry, robotic surgery and medical procedures, improved surgical precision, real-time decision. I just want to help you out here. AI in robotic surgery, there is something told by the company called OpenAI. How many of you heard about OpenAI? OpenAI is the ChatGPT's, where ChatGPT has been developed in the US, right? So OpenAI is the company, and OpenAI have published one video. There is one doctor, I don't know the name exactly, I have written that in the slides, in the next upcoming slides. So doctor have told that how that robotic surgery and medical procedures can be automated, and that patient doctor's time will be saved 90 or 95%. That is completely possible, and I can show you that things by playing one small video. In this short amount of time, it is not possible to explain everything. But here is one video that demonstrates everything related to the medical field by the OpenAI. This is not the summary by me. It is the summary by the top company from the US, and that is the this GPT-5 has launched recently, right? You have heard about this GPT-5. So, voice. So here is a one video that will give you the complete idea. This is by OpenAI.
System works and how it impacts different diseases.
Okay, let me first of all introduce you about this video, and then we'll quickly jump to that video. Yes, what researchers are saying nowadays. Immunologist and one of the professor, Dr. Deria, explains how he uses GPT-5. That is very important for you all. How he is using GPT-5 as a collaborator on the medical research. For that, there is a video that I'm going to play with you now here. See the video.
I've been using ChatGPT models as a collaborator. Is able to predict the outcomes of experiments that we haven't even done. That saves us weeks, sometimes months. Fundamentally, it will change the way we do science. My name is Dr. Deria Unutmaz. I'm a professor, a human immunologist. I've been working in the lab for the past 35 years, trying to understand how the immune system works and how it impacts different diseases. I've been using ChatGPT models as a collaborator for more than a year, but I think GPT-5 takes that to another level. Now I'm interacting with a model that knows more than me on my own field. It's beyond collaborator, it's almost like a mentor. Recently, I gave GPT-5 an experiment about some immune cells that are engineered to recognize cancer cells, and we had beautiful data, but we couldn't figure out what it meant. So I uploaded this to GPT-5, and it not only suggested things that we later on performed, but also remarkable new insights. It even suggested follow-up experiments. In science, the number of things you can try are almost unlimited. So if GPT-5 can suggest the right approach, instead of trying 1,000 things, you will try maybe 10 things, and everything will progress much faster. It's tremendous for brainstorming. It's back and forth, being able to critique my own ideas, and then come up with new ideas. That's the best I can ask for from a collaborator. So I think GPT-5 will help the patients to advocate for them.
Okay, so that's what I wanted to say here. I hope you have observed that how that US doctors actually using and integrating this AI in their work, right? In their work. This is the video by the doctor. What is the name of the doctor? It's a very difficult name. Can you read this? Dr. Deria dash dash. This is the name, and yes, this is the video by the doctor. How he have implemented. There is one standard. One research is also going on by the same doctor. How the AI can be implemented, and these things can be told in much deeper way. But at this time, that is. I don't have that much time right now to tell that all that things in detail. How Chat GPT-5 or some another Medjema models, right? Then some Llama models. Llama is one of the model like the Chat GPT. How these models can be integrated in these things in this medical science field that can be Most of the doctors that are already using that things in their work, right? So that's all about that medical field that they are trying to say. Most of the medical researcher, most of the professors are trying to say about uh, this innovation from the medical field. But for that, it is expected that one should integrate that AI. One should integrate that AI in their practices. Okay. So what we understand, and if we want to get in deeper insights about the same, let us have a one quick quiz, right? So for that, let us play one quiz, and for that you have to search on the Google Kahoot.it. So there are some questions that we have discussed on the topic today. So please search on the Google that Kahoot.it. There are some medical records related, some questions are there. We will discuss that here right away. Kahoot.it. So have you logged in to Kahoot.it? No need to log in, but just search Kahoot.it. And here I'm going to give. Is it asking for the pin? Yes, it is asking for the pin. So here the pin will get generated. So just put that pin. It is 927911, and please put your appropriate names there. So your names will be displayed on the screen. Waiting for the participants. The pin is 927. So Rushikesh, I can see. Dr. Rushikesh is there. What about the others? Please join it. Please join quickly. Yes, Dr. Karthik is there. Dr. Aditya is also there. Last one, are you able to see the pin? Or can I repeat? Pin is 9279. You have to search Kahoot.it, Kahoot.it. And is it the only 4 participants in this? Mark Spector. Who is Mark Spector? Then put your names fast, quickly. We have to start this quiz. Prashant, Dr. Prashant is there. Are you facing any difficulty in joining? Network issues, okay. Dr. Yudhishthir is also there. Okay, let us wait for a couple of minutes and we'll get started with that. Three winners will be taken from this quiz. So be careful with your answers now. Eight only? What about others? Please join fast.
This is not your exam, don't worry.
This is not the exam, this is just a small quiz.
Nobody is going to lose marks on microbiology.
Only 8. So shall we start with this 8? Shall we start? Yes. So let's get started with these 8 participants only, but I can see I think 50 to 60 participants here. Okay, here is the first question. These questions are all based on the topics that we have learned so far today in my session here. So here is the first question for all of you. That as per the research, what percentage of the doctor's time is typically spent on the documentation?
35%.
Yes. The answer is, I don't know. Check it out.
35.
Time is 10 seconds, 9 seconds, 8 seconds, 7. Hurry up, please. 8 possible answers, 9 answers are coming. Okay, great. So here the answer is 35%. Still, one of you are saying that it is 50%, which is not the accurate answer. Here is the next question. Who is the at the top position. Dr. Aditya is at the top position. And Prashant Doctor and Rishikesh Doctor is also there in the race. Which of the following is the big umbrella term? NLP, AI, robotics, machine learning? Seven responses are coming from you. Still two remaining, 8 more. Great. Yes, great. No one of you is saying is that it is NLP robotics, means you are trying to learn this session very effectively. And here is the next question. Dr. Aditya is still at the top. And which of the following is the, sorry, the third question is repeated. Let me skip it. Next question. Fourth question, machine learning ML mainly helps by making calls to patients, learning from past data patterns, prescribing medicines directly, translating languages only. Okay, yes, one of you is saying that translating languages only. And 9 of you are saying the correct answer. Dr. Aditya is still at the top. Who is Dr. Aditya? Okay. So looking forward for the result. Which AI branch can read and summarize doctor notes? And one of you is saying that it is machine learning. One of you is saying that it is statistic, but unfortunately the answer is wrong. Correct answer for this question it is NLP, natural language process, and let's see the scoreboard. Shilpa is at the top. Shilpa ma'am, sorry ma'am. Shilpa ma'am is at the top. And here is the next question. Example of AI in imaging. Detecting the pneumonia from chest X-rays, scheduling patient appointments, writing discharge summaries, and monitoring blood sugar in variables. So one of you is saying that monitoring blood sugar in variables. That is not the answer. Answer is detecting pneumonia from chest X-rays. Here is the scoreboard. Shilpa ma'am is at the top. What do the medical records include today beyond just notes? What do medical records include today beyond just the notes? Only lab result, scheduling patient appointment, only the prescription, EHR data, imaging prescription, variables. This slide has already covered in the class, right? Today. So here is the last 1 second, and last answer is EHR data, imaging and prescription of variables. Shilpa ma'am is still at the top. Which AI tool helps convert speech to text in real time? MedPalm is model, generative AI model. Google Docs voice typing, Nonce Dragon medical and MRI machine. The answer is Google Docs voice typing. And let's see the scoreboard. Yes, Shilpa ma'am is still at the top. MedPalm is a model designed specifically for banking industry, medical question answering, translation services, and game development. Be careful with your answer, only last 2 questions are remaining. Answer is medical question answering, and one of you is saying that it is banking industry, right? So here is the next question, but before that, let us check the scoreboard. Shilpa ma'am is still at the top, Dr. Aditya is at the second position, and here is the next question, second last question of the day. The biggest promise of AI in medical documentation is replacing doctors completely, printing prescriptions faster, reducing the documentation burden so doctors spend more time with the patient, and increasing the hospital billing only. Yes, the answer is reducing documentation burden so that doctor can spend quality time with the patients. And here is the last question. Last question is very, very important. As per my perspective, For me, it is very, very important. Let us check the scoreboard. Shilpa ma'am is at the top. And here is the last question, very important for me. Have you enjoyed the today's session? So the one who says no, then I have the data of that one who says the no. Okay. Let's see the answers. And yes, one of you is saying that no. I will check that data and will come back to you very soon. Okay. And here is the result now. Let us check the result. Who is the topper? Who is at the first position, second position, third position? At the third position, Mark Speck. Congratulations, Mark Speck. Dr. Mark Speck. Second position, Dr. Aditya. Congratulations, Dr. Aditya. And at the first position, Dr. Shilpa ma'am is there. Congratulations, Shilpa. Okay. So at the end, I just wanted to say that right now in IT field, in the IT industry, there is a formation, there is a preparation is going on. That is for developing the generative AI models. Right now in my firm also I'm trying to develop some generative AI models, but right now I have not developed any model related to the medical field, and I requires the expertise from your side. Right now I have already developed few generative AI models from the agricultural perspective, from the educational perspective, from manufacturing perspective, but not from the medical perspective. So I require actually the help. I will speak with the sir later on. I require actually the help so that your knowledge plus technical knowledge can be integrated in order to develop some generative AI models which are specifically related, focusing on the medical field. Okay. So with that note, we can stop. But if you have any questions, please feel free to reach out. Any questions? Yes,
We are
please.
individuals. We are not interested in how it works.
Yes.
So please tell me what exactly we can use.
Recording stopped.
So in the session, I already informed.